Not every brightening ingredient works for every type of hyperpigmentation. Chemical peels performed in the office can be really helpful for melasma. Knowing ingredients is one thing, but knowing how to use them together is what gets results. Consistency beats intensity every single time. If you've ever looked in the mirror and noticed dark patches on your skin, your cheeks, your forehead, around your mouth, and thought, I wash my face every day. Why is this happening? This video is for you. Dark spots are one of the most common complaints I hear in my office, and they're also one of the most misunderstood. People are spending hundreds of dollars on the wrong products, and in some cases, making their dark spots worse. Today, I'm breaking down exactly what's causing yours and what actually works. Let's get into it. First, let's talk about what we're actually dealing with. Dark spots, also called hyperpigmentation, happen when certain areas of your skin produce more melanin than normal. When something triggers that overproduction in one spot, you get a darker patch. Here's what most people don't realize. Not all dark spots are the same. And that matters because the type you have determines what treatments you need. There are three main types that I see in my practice. Number one, post-inflammatory hyperpigmentation, or PIH. The dark mark left behind after a pimple or a skin injury. Extremely common in medium to deep skin tones. Number two, melasma, a chronic condition triggered by hormones and sun exposure. It appears symmetrically on the face, cheeks, upper lip, forehead, and is notoriously stubborn. It's more common in women, especially during pregnancy, or if they're on hormonal birth control. Number three, sunspots. These are flat brown spots that occur from cumulative sun exposure over time. They show up on the face, hands, chest, anywhere that's seen a lot of sun. Knowing which type you have is step one. If you're not sure, that's exactly why you see a board-certified dermatologist. Now let's talk about what's making your dark spots worse, because I see these mistakes constantly. Mistake number one, skipping sunscreen. UV exposure is the number one driver of hyperpigmentation. Every time you go outside without SPF, even on a cloudy day, even just driving, you are actively making your dark spots darker. If you're treating hyperpigmentation without wearing sunscreen every single day, you're wasting your time and your money. Full stop. My go-to is the Elastin Hydro Tint. This is a tinted mineral SPF and it's great for daily wear. The tint helps neutralize the dark spots while you treat them. It also contains iron oxide, which is an ingredient that blocks visible light, which can also make dark spots worse over time. Mistake number two, over exfoliating. Someone has dark spots, they think, I need to scrub this off, and they start layering harsh scrubs and multiple acids. What actually happens? You irritate the skin, trigger inflammation, and create more PIH. You are literally making more dark spots while trying to get rid of them. Put down the walnut scrub, the sugar scrub, the salt scrub, whatever scrub you're using, stop using it. Mistake number three, using the wrong products. Not every brightening ingredient works for every type of hyperpigmentation. Vitamin C is great for sunspots. Azelaic acid is better for PIH and sensitive skin. Hydroquinone is the gold standard for melasma. Using a random brightening serum that you saw on TikTok is not a great strategy. Let's talk about what actually works. Ingredients with real clinical evidence behind them. Hydroquinone, the gold standard for hyperpigmentation, especially melasma. It inhibits the enzyme that produces melanin. Over-the-counter hydroquinone comes in 2%. Prescription strength is 4% or higher and is significantly more effective. Use it in cycles, not indefinitely, and always with dermatologist guidance. There's a lot of fear-mongering around this ingredient online, but when used correctly, it's safe and highly effective. I personally recommend it to my patients all the time for melasma. Tretinoin, this is an amazing ingredient. It works by accelerating cell turnover so that pigmented cells fade faster. The idea, it's recommended that you start low, so 0.025% to 0.05%, and pair it with niacinamide and hyaluronic acid to minimize irritation. There's decades of research behind it, and it's massively underrated for hyperpigmentation. Azelaic acid is also one of my personal favorites. It's anti-inflammatory, it inhibits melanin production, and it's gentle enough for sensitive skin and darker skin tones, and even more, it's safe during pregnancy. Over-the-counter strength, you can get it at about 10%, but prescription strength ranges from 15 to 20%. If you're not using this ingredient, you're missing out. Vitamin C is another great ingredient for skin brightening. A well-formulated vitamin C serum like L-ascorbic acid at 10 to 20% is excellent for brightening and protecting against UV damage. Keyword, well-formulated. Vitamin C on its own is unstable. So if your serum has turned orange or brown, it's oxidized and it's doing nothing for you. Use it in the morning and layer SPF on top. Niacinamide is another great ingredient. It doesn't directly block melanin production, but it prevents it from being transferred to the skin surface. It's anti-inflammatory and plays well with everything. It's a great supporting ingredient in any brightening routine. Chemical exfoliants, so glycolic, lactic, and mandelic acid can help resurface the skin and fade pigmentation over time. I like the Prequel glycerin and glycolic acid cleanser as a gentle daily option. Mario Badescu also makes a really nice glycolic acid cleanser. A weekly glycolic toner can make a real difference as well, but use it sparingly. If you've been consistent for 3 to 6 months and not seeing results, or you're dealing with deep, stubborn melasma, it's time to talk about in-office options. Chemical peels performed in the office can be really helpful for melasma. We use higher concentrations in the office of glycolic, lactic, TCA, or even salicylic acid to help resurface the skin and break apart some of that melanin. The results can be subtle or dramatic depending on how often and what strength of chemical that is used, but it's really not a one-size-fits-all approach. Peels that are too aggressive on darker skin tones can actually worsen hyperpigmentation, so provider selection matters enormously here. Microneedling is another great in-office procedure for post-inflammatory hyperpigmentation or pigmentary conditions. What it does is it creates controlled micro-injuries in the skin that stimulate collagen and enhance absorption of brightening agents. When combined with the right serums or growth factors or even exosomes, it can be very effective for PIH and uneven skin tone. I've seen great results with this in my practice. In-office laser treatments can also be used for pigmentary issues. I reserve procedures like IPL for sunspots specifically in lighter skin tones, but something like Fraxel, Clear and Brilliant, Moxie, or Halo can address deeper pigmentation. But, and this is critical, not all lasers are safe for all skin tones. Certain lasers at the wrong settings can trigger PIH in medium to dark skin tones. Always consult a board-certified dermatologist here before pursuing laser for pigmentation. This is not something to book at a med spa without doing your homework. Newer treatments like exosomes, so the science is genuinely exciting, but we're still in early stages, and quality control is a real concern. I'd encourage caution before spending a lot of money on something without robust clinical data. I'll have a dedicated video on that soon. Now let me give you a routine that you can actually follow because this is overwhelming, it's a lot of information, and knowing ingredients is one thing, but knowing how to use them together is what gets results. So in the morning, start with your Prequel glycerin and glycolic acid cleanser. It cleans without stripping and gives you a gentle daily exfoliation. Follow with your vitamin C serum on dry skin. This is your brightening workhorse for the day. Then your moisturizer. I love the Neutrogena water cream. It's lightweight and non-comedogenic. And then use your SPF. Every single morning, no exceptions. The elastin hydrogen is my top pick here for SPF. It's that tinted mineral SPF that not only hydrates the skin, but it also has iron oxides in it and gives a little bit of coverage, so it's doing multiple things at once for you. If you do nothing else from this video, at least use your SPF, do that step, okay? In the evening, if you wore SPF, which you will after watching this, or makeup, make sure you double cleanse first. So you want a clean canvas for your actives. Double cleansing can look like using an oil-based cleanser followed by a creamy cleanser to really make sure that all your makeup and SPF is off, or you can use a micellar water and a creamy cleanser, again to make sure all of the grime, dirt, and junk from the day is off of your skin. Then your treatment step. You have two main options, azelaic acid or tretinoin. Don't use both on the same night when you're first starting out. If you're new to actives, start with azelaic acid a few nights a week. It's gentler and anti-inflammatory. Once your skin has built tolerance, introduce tretinoin at 0.05% paired with niacinamide and hyaluronic acid to buffer any sensitivity. Typically, this formulation specifically is available as a prescription from your dermatologist. If your tretinoin doesn't have niacinamide in it, you can also add it after your treatment step to calm irritation and block melanin transfer. Seal everything with a good moisturizer overnight. And once or twice a week, add a glycolic acid exfoliant. It accelerates fading and resurfaces the skin. But I need to be clear, more is not more. I see patients who think layering 2 or 3 exfoliants every night will work faster. It won't. It'll destroy your skin barrier and create more dark spots, so keep it simple. The most important thing that I want you to take away is consistency beats intensity every single time. You will not fade dark spots in 2 weeks. Give it 3 to 6 months of daily consistent use. And if you stop wearing sunscreen even for a few weeks, you're gonna undo this progress. The sun does not take days off, and neither should your SPF. Dark spots are incredibly common and they can feel really discouraging, especially when you feel like you've tried everything. But with the right approach, real improvement is absolutely possible. So let's recap. Identify your type of hyperpigmentation, wear SPF every single day, use ingredients matched to your specific concern, be patient, and if you're not seeing results after a few months, come see a dermatologist. Now, if this was helpful, give this video a like and subscribe. I break down topics like this every week. Drop your questions in the comments below. I read every single one. I'll see you in the next one.